Lovely to see you. Lovely to see everyone.
Hello.
Hi. So it may be 6:05, I think, right now. So I'm going to jump right in there, and then I ask my co-host to join me after introducing myself. I know most of the people on this call, which is a lovely feeling. It's like going to visit friends and HAAC family. I'm Sharon Davis-Murdoch. I'm the co-president and a founding member of the Health Association of African Canadians, and I'm delighted to be with you this evening. And over to you, Co.
Hi, I'm Veronica Marsman. As Sharon stated, I'm the co-chair of HAAC as well as the past president for the Association of Black Social Workers. I am semi-retired, although nobody believes that, not even me. And I'm a proud grandmommy. I have 2 little ones.
Well, welcome everyone. I'm David Hawes, retired physician and past co-president of HAAC. Great to be here with you all.
Yes, this is gonna be painless.
Yeah.
We're right. It's just going to be information, and conversation is going to be painless. So I will jump in, and then my colleagues will take over. But I first want to let you know that this is one of many of our town halls, and we started at the beginning of COVID, and I don't know. Let's hope this is the end, but you never know. We've learned not to say that too often, because you don't know what's around the corner. But we're here tonight. We're going to start this town hall with a presentation that my co-president has put together for us, and she's going to direct the traffic, and she's going to say, Sharon, you talked about that one. You know, she's going to direct the traffic, so we'll all know what to do. And then after that, that's going to give you some background about HAAC and our work in the area of COVID-19. And then we are going to have an amazing panel presentation or sharing. We're going to hear from our illustrious panel members who are going to introduce themselves a little bit later on. And then we're going to have time for really good time for some interactive questions, because that's where the learning, a lot of the learning happens at the end. So, so I think that I'm going to hand that over then to Veronica to kind of guide us on the presentation, if that's okay with you.
I'll pull the presentation up, and actually, let me put it in presenter mode. Can everybody see that? What do you see?
Full
We
screen
see-
slide.
Yeah.
Just the
Yeah,
presenter?
that's good.
Looks good.
Yeah, looks good.
Perfect. Okay, so Sharon, you're going to take it away with this one.
Yes, well, I want to just give you all a little bit of background. As I have said, we began having town halls at the very beginning, and really close partners with the Association of Black Social Workers, so that this COVID initiative is one that is called the ABSW/HAAC COVID initiative. We went from response to the response to COVID. We took people through the impact of COVID, which I know that Veronica will tell you more about later. And we ended up at a place where we had vaccines. Now, I want to just preface that by telling you that that sounds like it was just smooth sailing and everybody was cooperative at the government level and at Nova Scotia Health level and so on. It was smooth in the sense that we were supported, and Veronica will tell you about that, to do the work that we were doing. But when it came time to have vaccination clinics, Dr. David and I had lots of media interviews where we talked about the need for culturally specific African Nova Scotian vaccine clinics. And there was a little bit of conversation and persuasion before that actually happened. So we initiated that. It wasn't given to us. It was something that we had to advocate for. So indeed, through the process of our initiative, we always were provincial in scope. There was never a time when we were not. We had members from across the province, and we had an infrastructure that the Association of Social Workers had in place prior to there even being a COVID-19. And so we were able to take advantage of that and really bolster that to have the initiative happen. We met as a team weekly. Now we meet monthly, and that is a 1733 calls on toll-free line to the end of May. We still get calls occasionally, and we are hoping, we're hoping against hope, that our initiative will wind down next month. But suffice it to say, we've been through a journey, and they're going to tell you about that, certainly starting with Veronica. But I want to tell you where we ended up. We've ended up in a place where our COVID-19 initiative has started culturally specific policy as a precedent. We've ended up at a place where health data with race and ethnicity has begun to be collected, and we hope that it will continue. And indeed, we have built with this initiative of ours, Black health infrastructure, and we hope again that that will continue and flourish. So with that said, over to you, Veronica.
Okay, so thank you, Sharon, for laying the context in terms of the COVID initiative overview. And as she stated, we've gone through several iterations of it, you know, from the response to the impact to the vaccine. So in terms of the response, what that looked like, Sharon's already spoke to you about, you know, several town halls on vaccine, even the one tonight, you know, on passports or, you know, so we've had several of the town halls. We established the toll-free line. So the toll-free line isn't a live line, so don't expect to call and then somebody's going to pick it up. You call, leave your message with your number, and somebody, one of the ABSW members, will get back to you in a short time frame. The COVID initiative team is represented, and you'll see the org chart for that shortly, but it's represented by various disciplines or various areas that we felt that we need contact with: an ANSA representative, a school board representative, folks who were struggling with COVID issues related to various disciplines. Funding wasn't an issue. I love to say that during, you know, an initiative, that funding, we had funding coming out of our nose to deal with this. People were very generous, which is great, because as we know, when you're writing grants and doing grants, sometimes it's not like that. You're always penny pinching, but we were able to get funding from a number of resources that Dr. D will share with you later. We also, what made this initiative unique is that we established community coordinators. You heard Sharon talk about the fact that it's provincial. Well, it's provincial, but we know our office here in HAAC is located in HRM. So how are we going to reach everybody effectively? We establish community coordinators. So just about all of our communities have a person that they can connect with. So if they have an issue or they have a need or they require service, they can either call it in and we would deliver it or connect with their community coordinators to make it happen. We also have distributed three community newsletters, which we want to keep people updated. There should not be a person of African descent in this province who doesn't know about our initiative. We've put it out, it's been publicized, there's been lots of promotion about it, and that will continue until the project is over. So this just gives you, just shows you a little bit of the couple of the town halls that we've had. So as you see, you know, fact and fiction, I think that was our very first one, was it not, Sharon, where there were lots of myths out there about this vaccine and what it was going to do to us and whether or not we should have it or we're immune to it as Black people, all these myths that were out there. So we brought in the doctors to talk about what's real, what's a fact, and what's fiction on it. You know, the town halls, just as the vaccine was happening, we would, and recognize the need, we would bring people in to inform us about what was really going on in our community and how it impacted our community. So you've probably all seen this flyer where it has the toll-free number on it. And then this is our org chart. So as you can see, it starts, you know, Sharon and I are the co-managers, you know, thick as thin as thieves in this initiative. We have our community coordinators working with us. It would not be the initiative without them, our toll-free line. And then we have our other supports, the people that we work with. So our HAAC coordinators who deal with all of the health and mental health issues, our health coordinator connection to the Department of Health and
Nova Scotia Health, Nova Scotia Health.
No, Nova Scotia Health, and then the other health board, that's what I was thinking. And then our AUBA coordinator, as you know, we had lots of spiritual issues to deal with, lots of grieving happening in our community. So someone there, our educational consultant for the kids' needs, as you know, the kids were out of school for several months, but still we wanted our students to continue with their education. Our ANSA coordinators, so if we had issues in government, that's who we would go to, and as well as the Department of Community Services, who not only provided funding, but also has developed and set up food boxes. So this just gives you a sense here, this chart here shows our list of community coordinators, and the other three are the front page of our newsletters. So if you haven't received a copy, we do have electronic, so just contact us and we can get that to you. So this is over, is this you? Where am I at? No, okay. I keep going, David? Okay, so
yeah, keep going.
When we moved, so you were still into response, yes, it is me. So during the response phase, we provided food boxes. This is now, it's kind of like, oh yeah, I remember back then. This is when COVID had first kicked off, and we were really, really encouraging our folks to stay home, do whatever they can to stay home. But yet we recognized that meant not getting out to the grocery store, not going to the drugstore. So we were delivering food boxes to areas that really required, that we required them to stay at home. We were also working with the Department of Community Services to provide, and the Health Authority, to provide shelter for people who could not go back to their home because the people in their home were not testing positive, and so we didn't want them there. We also provided vast sanitation supplies. So again, thinking back, this is when the hand sanitizer was first coming. You couldn't even get it. You couldn't find the stuff around in the stores, and the wipes. So we were providing those, and then anything that we could set up to keep people at home, whether it's tablets, cooking sessions, games, just to keep people at home and safe. So this just shows you, you know, a typical food box. set up that the Department of Community Services was able to arrange for us. Here you can see some of the masks, the face masks that we also distributed, not only to individual homes, but at that time we were also going to events. So somebody called the toll-free line saying we're having a funeral and we need 100 masks. We would supply them with hand sanitizer and masks, as well as cleaning supplies. You could see here some of the games that we distributed orally, as well as some of the tablets that were provided to seniors to help them stay in touch with one another. And also we had the cooking session. So we had a chef that was located in HRM, and the community coordinators would shop for whatever the menu was going to be for the participants, deliver it to them in these grocery bags, and they would go online and they would prepare a meal for 4. And it was youth, there were youth, there were fathers, men that participated, women, seniors, you name it. It was really a highlight. People enjoyed the cooking sessions. And now we're going to turn it over to Dr. D for the impact.
Okay, thank you, Veronica. So as Veronica and Sharon had said that as well, once the acute COVID-19 response phase was completed, we rolled over into dealing with the impact of COVID-19 on our Black communities. And so we continued, same team, to provide culturally specific health information as needed. And we provided services. There were a lot of needs for things like mental health and grief support. And we put on sessions, online sessions for mental health and grief. There were medical needs. People requested medical equipment. So, you know, we were able to provide some of those as well. There were people who were concerned about the issue of vaccination. And in terms of medical needs also, we had people who had run into issues and needed help navigating some of the services that they would require. The vaccine bit was really huge because, as you all know, there were a lot, and still are, a lot of misconceptions, misinformation going on about the vaccines, and we just had to address those as well. Here is, back up a little bit for me, Veronica, please, one before. So here is just a picture on the left. You'll see some medical supplies, including blood pressure monitors and some thermometers. Next slide, please. And here are posters. On the left is a post on meditation and yoga sessions that we put on. And then on the right, the mental health, grieving, healing sessions, just to show you an example of some of the things that we had provided. So the vaccine rollout was, as you know, in the province, really started in December, but we did not get involved until about March. And as Sharon had told you, we were, we worked at having vaccine rollout to the Black communities and worked with the Department of Health and Wellness, Public Health, and you see ANSA was involved, and Communications Nova Scotia. And it was really tremendous. We were able to work with these partners to put on clinics in different areas that were really staffed by people of African descent. And it was the atmosphere in the clinics were within easy reach of the communities of concern. So people were able to come out. We had a system where we would help people to register. So they would call in, we would actually register them for these clinics. And we had a coordinator, Deborah Gannon, and give a shout out to Deborah because her work was tremendous as well. we were able to put on 15 of these clinics, and you see the number that were vaccinated through these clinics. The crucial thing here is that we also had a lot of media opportunities that flowed when we put on these clinics. So, and many of you probably have seen the videos online. So that was also a way of encouraging our population, our people, to get vaccinated. We estimate, and it's a conservative estimate, that overall 60 to 70% of people who self-identified as Black or African Nova Scotian have received 2 vaccines. Now, I say it's conservative because we depend on people to self-identify, and we know that there are those who would be unwilling. There's, why should I, etc. So we think it's a higher number than that, which we think is really, really good. We will continue to help with the vaccination of our Black communities. We're not going to have those specific clinics anymore, but if anyone in the community would like to be vaccinated, they can call that toll-free line. We will help them to register at a site near to them, close to where they live. And if needed, if there is a group of people in one particular area, the mobile health unit will work with them to do what we call a pop-up clinic in that area, so that they will have access to vaccine as well. So the vaccine effort is still going on as well. The cultural video clips, and you'll see that these are some of the, well, go ahead, Veronica, just to show some of the graphics that came out at the time during vaccination. On the left, you'll see notification for some clinics, New Glasgow and Amherst Spring Hill. On the right, you'll see a photograph taken of one of our community members receiving the vaccine. And if you keep going, Veronica, you may not recognize her, but the person in the back is Veronica, and that's her mom in front. So they're coming out of a vaccine clinic, and you can see some of the staff that were working there as well, but those were tremendous. And of course, now we come to the situation where, as you know, many jurisdictions, provinces, international jurisdictions, airlines are now putting into play the proof of vaccination, or what they call a vaccine passport, as a requirement for things like international travel, maybe they're for domestic travel. Many of the provinces now are talking about using these for entry into local establishments, restaurants and bars, and going to events. So, we've gotten to a stage now where we need to address this issue, and that's the reason for our town hall tonight. The last slide, I think you have there, Veronica, or second to last one. So again, going forward, the toll-free number is still going to be in place for the foreseeable future. So it's going to be there for anyone in our Black community who needs help in any way, particularly with health-related issues. They can call that number. We're planning, eventually we will have more town halls depending on how things go moving forward. Mental health and grief sessions will continue as well. And we, as I said, will have pop-up clinics as needed. There are also some computer sessions. There are a bunch of seniors right now who are being taught to use the technology, and we will be having health sessions as well. And the last slide is just an acknowledgement of the organizations that provided funding. Tremendous. We're just really so appreciative of the fact that we were able to get enough funding to provide services for our communities. So ANSA, Community Services, Sobeys, United Way, Good Food, the Community Foundation of Nova Scotia, Red Cross, so the list is there. And again, we so appreciate the fact that we were able to provide, appropriate services. One thing that just even going back to when we had COVID, And as you know, many of our community members live in multi-generational homes where if one person is positive or suspected to be positive for COVID, it's very difficult to self-isolate. And so we were able to provide even hotel rooms working in conjunction with public health for that situation. So, I mean, it was really, really tremendous. So I think that's the end of our presentation, Veronica, if you want to stop sharing. Now, we intend to have time at the end for discussion. And so we're going to go into our panel presentation. Is Dr. Nnorom with us yet? Did you see her come in, Barb? Not Barb, sorry, Carla, Barb, Carla.
I did not yet.
Okay, we'll start anyway, and hopefully she'll be in very shortly. We have 3 panelists with us tonight, and we're going to ask them to introduce themselves. We're asking all 3 panelists to address the same question. And the idea here is for us to have an informed discussion on the issue of proof of vaccination certificate, or some people are calling them vaccine passports, so that we can be informed as to what this means and what it would mean for us as a Black community, whether we're vaccinated or not. So, you know, it's sort of, there's arguments on both sides, and we know those are going on, but we thought that this would be an appropriate time to have this. You can put questions in the chat, we'll monitor those, and after the panelists have done their presentations, we will have time for questions and more discussion. So the question we're asking our panelists is, what do we as a people need to know about proof of vaccination and vaccination passports? So what do we need to know? And we just need to their perspective. And we're going to ask Dr. Baylis to start first. Introduce yourself, go ahead. Then Jason, you next, and Dr. Nnorom will be the final presenter, and then we'll go into questions. So thanks again.
So hello, I'm Francoise Baylis, and I'm a philosopher who has specialized in bioethics, and so deeply concerned about ethical issues and health. I've actually been thinking and writing about this idea of vaccine passports when it was first called an immunity passport, because we in fact didn't have vaccines. We just had people who were perhaps getting COVID, had survived COVID, and were then arguing that I have antibodies, I'm protected, I shouldn't have to suffer all the consequences of a lockdown. And if you want to restart the economy, you have to let people like me roam free. I don't need to be masked, etc. So I've been writing and thinking about this for a long time, and then along came vaccines. And early on, a lot of the concern was about restarting the economy and international travel. And so the first point that I think we need to be aware of is the following. I think language matters here, and I actually think it's really important for all of us to move away from the word passport, unless perhaps we're thinking about it in the context of international travel. But even there, I would say we should be moving away from that. The reason is the following. What you really have is a certificate. And then comes the controversial issue, what can you use this certificate for? Who can demand to see this certificate? Who can either open or close doors based on the information you provide? But the point I want to make is that anybody who has been vaccinated already has exactly the information that people are thinking of as a passport. You already have that. If you've been vaccinated, you know the day you were vaccinated, you know what kind of vaccine you got, and you know the lot number. It was given to you, and if you've lost it, it can be retrieved. You already have all that information. So what we're really talking about is who can use this information for what purposes. So that's the first thing I think is really important. The second thing that I think is important is we've seen a transition. So originally it was primarily about international travel and getting people back to work. But with the most recent iteration, what we see is the move into what I call activities of daily living. going to a bar, going to a restaurant, going to the gym, things like that. And I actually have real concerns about that move, because for me, it really talks about the creep of this kind of certification, whereby we're going to start introducing more divides based on biology. So I want to say very clearly, I think that proof of vaccination can be a very useful public health measure. I'm not speaking against it as a public health measure. What I am saying is that there are a number of problems and challenges which come with this and with endorsing this if there are not very clear parameters around it. And those parameters, I think, have to be regulatory, and that's to protect people. And in that context, what I mean is there have to be rules and regulations about who can access this. We have to be rules and regulations about how you're going to avoid problems of discrimination. There have to be rules around, when is this going to expire? Because this can't be a new way of life. This can't be what it means to get out of a pandemic and to now have this kind of documentation required of us as we try to just live our lives. So what I want to do in the very brief time that I have is I'm just going to name a list of my concerns with this proof of vaccination. And if people are interested, I actually recently created what I call a public-facing website. So it's not my academic university website, which is heavy, dense, not all that interesting to people. But if you just put in my name, francoisebaylis.ca, you'll get there. And I have a whole section just on COVID-19. And several of those pieces, articles, radio, podcasts, all talk about these issues. And I'm happy to expand on that later. So here are my concerns, and please hear them in a context where I acknowledge that proof of vaccination can be a very useful public health measure. And I also think vaccination is a moral responsibility. So I think people should be getting vaccinated. But here are my concerns. First of all, I'm worried about places where they have made no provisions for any kind of exceptions for people who are not vaccinated. And we've seen that quite dramatically, for example, in British Columbia, where there are not even medical exemptions. It's if you want to do these things, you have to have been vaccinated, and you haven't been vaccinated. We don't want to hear a story. We're not interested in your explanations. We're not interested in your medical condition. You just can't participate in these activities. That's deeply, deeply problematic, because there are all kinds of reasons why people may not be vaccinated. So I definitely worry about that. If there are going to be medical exemptions, which I think there need to be, there has to be clarity about that. And one of the things that's really important here is that places that have allowed for medical exemptions have started to say things like, well, you have to have proper documentation from a physician or from a nurse practitioner or an allergist if your claim is an allergy. Well, we know that many people don't have access to physicians right now. This is a problem in this province. So if you have a legitimate reason for an exemption, how are you going to get that paperwork? And in some cases, some doctors charge for that paperwork. So for some people, that's going to be an additional barrier. I think we have to worry about that. And I think we have to worry about what counts as a legitimate medical exemption. And here, what I often use just to make the point is, where does fear of needles fall on that spectrum? And I'm talking about it in a context where it's actually recognized as pathological. I'm not saying, oh, I'm going to cry or I'm going to faint. I'm talking about people for whom this is a real issue. So I think that's a second thing I'm concerned about. Broadly, I'm also concerned about what I put under the banner of risks of harm. And there are many people that I'm worried about here. In a very general way, I think it risks exacerbating divides that we already have within our community, and it risks decreasing trust in government, which we can't afford right now. I think that there are real risks to the people that have to actually enforce this policy. So unless these small businesses, for example, are going to hire proper security guards, they're really going to turn to their staff that's already there and ask them to implement and enforce this program. Well, I can imagine people at the door being verbally, if not physically, attacked by people who are angry. And there was an article today about what's happening in some of the public gyms. with respect to that. So Cole Harbour Place was the place that was identified where people are being harassed for just trying to respect what will be the rules starting October 4th in this province. I'm also worried about people who may not gain access for reasons of discrimination. And I think, we have to acknowledge that that exists. And so when you get turned away, will it be because somebody really didn't, accept your proof of vaccination? Or is it that for some reason they're able to use that as a way of refusing access? And I think we need to think about that, especially amongst communities of refugees, of recent immigrants, or just of visitors who are coming, who may not have the kind of documentation that someone's used to seeing, and on that basis, perhaps get refused. I'm also worried about the cost. And here, what I'm really worried about are the opportunity costs. This will be an expensive system to put into place. Why? Because we're not using what we already have, which is that everybody has this email and they can just print it, show it, and be trusted. But we're talking about building a whole IT infrastructure. Some places are building QR codes, etc. This is going to be very costly. And if this is being done right, it's going to have an expiry date. So some places have already announced their expiry date. They're expecting it to end at the end of the fourth wave. They've said things like January of 2022. So a lot of money is going to be spent on this that I argue maybe could be better spent on other things like, handing out free masks, like handing out free sanitizers, like giving people paid time off work to go and get their vaccine, or if they're ill, paid time off work to stay home. So one of the things that's really important is to understand that while this can achieve important goals, it's expensive. And is this the best use of money locally? And I'm only asking the question. I think in some places where you have rampant problems, for example, right now, Alberta, Saskatchewan is a very different thing from the situation in Nova Scotia. And we each have to, if you will, look after our resources appropriately for our particular challenges and needs. Just a few other quick comments. I'm worried about technology creep, and I have made this point on several occasions, which is that it starts off with something that looks reasonable. We need to know what your COVID status is. Have you been vaccinated? But then once you've spent all this money on this electronic infrastructure, I can imagine it sticking around. And so now it's like, well, that was really useful. Why don't we just put all your vaccinations on there? And that's really good. And then you can have all your vaccines in one place. And then somebody else will say, yeah, but why not put your whole health record? Haven't we been talking about an electronic health record forever? Let's put that in there. And then, didn't you do that ancestry tracing? Let's put your genetic data in there. And then I just worry on and on and on. And the reason for the worry isn't that it's a bad idea to have all that information in one place. It's who has access to it? Who controls the access to it? Is it you? Is it the company? Is it the government? And who can demand? Eventually, will it be the police officer, the immigration officer, a government employee, the person at the hotel you want to go into? And so I think it's really important to understand once you build this infrastructure, it may not go away. And the classic example, and many of you are at least my age, you'll remember what it used to be to get on a plane, right? And you used to be able to run if you were late and get on the plane. And now if you don't allow an hour and a half, you might miss your flight, right? Why? Because we have all these procedures in place for our safety. And that's what this is going to start off with. This is for our safety. And yet at some point, what will we end up with? And I just think we need to think about that future. We already have concerns about fraud, and we have this information from a number of places, jurisdictions, and some outside Canada, where we have fraudulent passports being created. We also have seen what is being described as a backlash from anti-vaxxers now. So it's given them one more thing to argue about. Look what the government's doing to us. Isn't it terrible? And that's where I worry about the whole thing I was talking about with respect to trust. And the last thing I want to emphasize is I do worry about creating a false sense of security or safety, if you will, around this. The idea that once you're vaccinated, you're good to go. And that's why you will be able to move about freely in society, whereas other people who are not vaccinated will not be able to do that. And the reason I'm concerned about that is the following. We know that no vaccine is 100% effective. Even the best vaccines were claiming 90%. We know that a number of people, including myself, when I was vaccinated, have received an AstraZeneca and a Pfizer. So we don't actually have the same kind of robust data about what that looks like. We know that AstraZeneca was originally at least identified as lower. Now, please understand, vaccines are very good. I'm just saying we have different efficacy rates for different vaccines. And we now have the Delta variant, which also, according to some research, has an impact on the efficacy of the vaccine, reducing it in some places, according to the research, by as much as 30%. All of this is not to undermine the value of vaccines. It is to say, however, that why would you embrace proof of vaccination and get rid of all of the other public health measures that are in place, which we know are helpful, like masking, like social distancing, like gathering limits. But in many jurisdictions, this is like the payoff. It's like, you got vaccinated, great. Now we're gonna give you proof of vaccination and you don't have to do all those other things. You're free again. And so I'm actually worried about it when it's not thought of as just part of a toolkit. It's one more thing that we're doing to protect ourselves and to protect our community. And I think that that's really important. And I think the reason it's then really important to think about this is we have alternatives. The alternatives are to have rapid testing as an option for those who are not vaccinated. I think that's especially important with respect to activities of daily living. And when we get to a conversation, I'll say more about that. My last point is a point that I make in a lot of my areas of research and work, and it's a point about directionality. People will be able to demand of me, of you, to see information about your vaccine status. You and I will not be able to demand that of other people. So for example, if a police officer stops me because they're alleging a traffic violation, and I don't want to roll down my window because I haven't seen their proof of vaccination, I can't just drive off. And I can't demand to see their proof of vaccination. I'm just giving that as one example. You know, if I've been in an accident and a paramedic is coming to help me, I can't say, oh, you can't touch me until I see your proof of vaccination. So there's something really, really important to think about when you introduce a mechanism where only some people can use it and have control over other people's behavior. And it's not actually a shared responsibility, right? I can't say to my doctor, show me your proof of vaccination, or you can't, you know, work here. So I just want people to think about the complexity of this. And I please, please, please want people to hear, I support vaccines, and vaccination passports can be a very, very useful public health measure, but they are not simple. They're very complicated, and there can be harms and repercussions. Thank you.
Thank you, Francoise. Jason, over to you.
Thank you very much. The doctor has me canceling flights as we speak. Thank you, everyone, for coming tonight. And it's truly an honor to be here to speak on this subject. My name is Jason Maclean. I come from Sydney, Nova Scotia, Cape Breton, Whitney Pear. Shout out to Her Honor Mayanne.
Welcome, Mr. Whitney Pear, very much.
That's our home community. The way I look at the vaccine passport, I was in a few calls with public health and speaking with Dr. Strang and others, and it really raised an eyebrow because just a few months ago, that's what was happening. We were getting that. And that was with meetings with labor and public health. And we raised a few questions. And what it caused him to do was take pause in it and go seek legal advice. And that's what we did as well. So being president of NSGEU, we have 34,000 members. And they're from every walk of life in Nova Scotia, from Department of Community Services to NSLC to correctional facilities where I come from. So what I did was reach out to our legal counsel, which is Pink Larkin here in Halifax. And I really want to look at it on the advocacy end. If we have an employer that really wants to put the vaccine passport or a vaccine mandate, as we call it in the workplace, on people to be able to come to work, to which we find problematic. And that came because we have one employer right now that has informed the employees that they're going to give a mandate to them to be vaccinated. And so that really caused us to get a push on this because we felt other employers would be reaching out to do that. And now I want to preface this with, this is a legal opinion based on case law. And there's a few pieces that I really would like to share with people. And I will tell you, I'm vaccinated, proud to be vaccinated. And you know, I do believe that is what's going to help us out in the long run. But the question that I always had is it right for somebody to be asking me if I'm vaccinated? Although I do share. Also, I do want to highlight the other issues when I finish this that myself as a Black man would have just living life in Nova Scotia or even going to work, because there are other issues that are there that aren't outlined within any type of legal opinion. So the whole summary, to keep this part short, the whole summary of the legal opinion is, in most cases, an arbitrator, if we were to challenge any type of vaccine mandate that came from an employer, an arbitrator would likely uphold an employer's need or want to have that. But there are some parameters that an employer must follow. So I just want to discuss one thing that's called, it was back in 1965, we had a lumber mill and sawmill workers union versus KVP company. And out of that, it created a test for employers who want to implement things without consultation with the union. And I say this for a union because obviously anybody that's a member of NSGEU, they're in a union, they have representation, and consultation must happen in most parts of it. Although keeping in mind there are pieces where an employer would have employer rights and be able to deal with issues that are outside of the collective agreement and not necessarily spelled out within it. The first part is it must not be inconsistent with the collective agreement. And that's a very important piece, because when you hear that, you think it's just simple, that it must not be inconsistent with the collective agreement. Well, in a lot of collective agreements, it speaks to the fact that you know, an employee must submit a sick note to an employer if they're sick or whatever. So really, is it inconsistent with it? That is something that you know, could be argued, but again, it has to come within the collective agreement itself or be consistent with it. It must not be unreasonable. It must be clear and unequivocal, both to its requirements and its consequences of its breach. And it must be brought to the attention of the employees affected before the rule is acted upon. And it must be consistently enforced. So those are very important points, but I just want to get into the reasonableness part. So an arbitrator will probably focus on, is the policy reasonable? And I just want to make this point about it. A vaccination policy should be supported by evidence, and it should strike the appropriate balance between health and safety and protection of an employee's privacy. Bodily integrity, and it clearly must be fact dependent. So not all cases are equal, not all cases are the same. So also under occupational health and safety, the reasonableness of a policy would be assessed in the context of the employer's obligation to the OH&S Act. And the Act says every employer shall take every precaution that is reasonable in the circumstances to ensure the health and safety of persons at or near the workplace. So when you say that, then an employer has an obligation to keep me as an employee safe, but also to keep the client safe, or whoever's frequenting the restaurant or whatever workplace it is, to keep everybody safe. And employees have a corresponding obligation under the Act to take every reasonable precaution in the circumstance to protect the employee's own health and safety and that of other persons at or near the workplace. So that would be my coworkers and anybody that's coming in there. So everyone in a workplace has an obligation to make sure everyone around there is safe And if that's not the case, then employers, all can be taken to task. And not only that, you could have clients that are coming in as well. You've seen those signs over the years: no shirt, no shoes, no service. Well, those are things that were derived from health and safety. Also, it's an employer's obligation to work with the employees, and anything that's put in there may actually exceed whatever public health guidance is. So again, I'm not saying that the employer is correct in implementing anything like that, but what I'm saying is they do have solid ground to move forward on it, and then the argument on the facts would have to happen after that. And privacy, the whole privacy issue is under the reasonableness analysis. It requires a balance of interest: the employee's privacy interests on one hand, and the employer's interests, such as workplace safety, on another. So again, and I'll go back to what I said in the beginning when I talked about the collective agreement and it being in line with the collective agreement. If you're already giving certain medical information to an employer, then quite possibly new information could be compelled in the spirit of that's already consistent with the collective agreement. And I always qualify it by, I'm not agreeing with the employer. I do well when I don't agree with the employer. So I just need to put the facts out there for people to know. All right, so and also, if something is in the collective agreement, it shows that both parties have agreed to certain aspects of the workplace. And so you create a set of rules that everybody must abide by. And when those rules are broken, then that becomes a grievance, either a grievance filed by an employee or a grievance filed by an employer. And then that's when you get into the dispute where you would have an arbitrator agree or disagree with anybody's arguments that are brought forward. A lot of times we like to go to mediation to have things worked out on an issue. So another key piece to this is workplace disruption. So an arbitrator would consider the broader impact on the employer's operation. And if the employer fails to get vaccinated, the employer's services may be interrupted because of the facility closure and the person required to self-isolate in the event of an outbreak. And I've recently seen this in Nova Scotia Health Authority, where they came up with a policy that, and we know this from early on in the pandemic, this is before any type of vaccines. If I was exposed or an exposure site and I had to self-isolate, then employers were actually implementing a policy that gave you special leave during that time because we're entering into a pandemic. We didn't know what was going on. Employers now are starting to drift over to, well, if you're vaccinated and you were in an exposure, then you can get that special leave. But if you weren't vaccinated, which we're trying to ask them, how are you going to know if somebody's vaccinated? But if you weren't vaccinated, then you would have to take sick leave if you have to self-isolate because you didn't take those steps to protect yourself by getting vaccinated. But again, that turns into the argument of, how would you know if somebody's vaccinated or not? They don't have to divulge that to you. Well, I believe we're on the cusp of that question being answered, and we'll see that before October 4th when everything is supposed to be in place by this new government that we just elected. Clarity, notice, and enforcement. When you talk about the final three factors that I read to you before, one must keep in mind that what about my human rights is what people say. So when it comes to somebody's human rights, and I'm going to read this quick little section. It says, in addition to the above considerations, employers is also bound by the Human Rights Act and recognized in Article 5.01, as with any workplace, an employer would have a duty to accommodate to the point of undue hardship an employee who has a disability or religious objection that precludes compliance with the policy. So if you had any religious objections or if you had a disability that precluded you from being able to get the vaccine, then an employer must accommodate you. But it goes up until the end of undue hardship. So I have an employer that we've been talking to in the South Shore province, and they don't have too many staff, and about half of them are not vaccinated that we know of, just from people supplying that information. And so if they ended up off sick, or they wanted to get placed into a different place, because some employers are large, they could take me and put me in another part of the organization to be able to do some work. That's accommodating me, where I'm not interacting with the public or anything like that. So that's fine. But if you have too many people in your organization that are at risk like that, or looking for accommodation, then the employer may try to do that. But if it causes undue hardship on the employer to be able to do whatever business it is that they're doing, then the employer themselves wouldn't be subject to, they could still be subject to a human rights complaint, but in all likelihood, they would be successful in saying that they put the effort forward, but they really couldn't do it and continue to do their business. So that's the undue hardship. Also, personal skepticism or hesitancy about the vaccine wouldn't entitle an employee to an accommodation under the Human Rights Act, right? So again, in conclusion of our legal opinion, there's a lot of factors that aren't weighed there, but there is a lot of jurisprudence out there or case law over the years, and most recently 2020 as it pertains to COVID-19, that the courts have been siding with the employers and not siding with the employees. So these are some real considerations we must have. So as a union, I had a statement put out to our membership, and really outlining what we have here in the, and I'll find the link and I'll put it in the chat a little later, but really outlining it. As an organization, we've been following public health guidance the entire time. We'll continue to follow public health guidance to be consistent as leaders for our members. But what we want to do is really educate people on where things are. And right now, I just want to talk as, you know, being a Black man in Nova Scotia, I have other unique issues working in the workplace. So if I was dealing with an employer that wanted to know the information on me, well, I already have mistrust with the health system. I already have mistrust with authority in this province, and really don't, you know, in some aspects don't feel that, you know, my interests are being brought forward. But also, I tend to see, and this is through my experience, 26 years of being a union member and activist within NSGEU, that we're at a disadvantage when we're dealing with an employer. When you're in a workplace, when you have, you may be the only person that looks like you in that workplace, or there's few people that look like you in that workplace, and your concerns that you bring forward, you're not getting answers in the community, you're not getting answers at your workplace, but your workplace doesn't understand your community as well. And you start running into issues such as that, to where we already have systems that are working against us, and that becomes problematic. So I just wanted to acknowledge that, because when you talk about a legal opinion, or you talk about the aspects that your employment may lie based on your decision to get vaccinated or not vaccinated, that we're already behind as it comes to representation, or it comes to understanding by most employers. So I want to thank everyone for having me here. It truly is an honor, and I'm open for questions when everything opens. So thank you very much.
Thank you very much, Jason. Really enjoyed that. Dr. Nnorom is supposed to be joining us. She's a bit late. And I wonder if we should, Sharon and Veronica, what do you want to do? You want to start taking questions before she comes in?
It might be a good use of time to invite people to pose questions to either Francoise or Jason. And then when Dr. Onye comes, we can move to her presentation.
I just have
Miss
two questions first, Doctor.
I'm sure. Just
Yes, I
hang on.
do. Ani just texted. She said she can't get in, so I'll send her the link I have, but I don't know if she's in a waiting room or needs to be let in. I just wanted to say,
We just emailed
She's-
her the
she's
link.
not- Just David, if you go into participants, just invite her right to this link.
Well,
That'll be the
I just sent her an email with the
Okay.
link to her Gmail address, Dr.
Okay.
Dragon.
I'll let her
Dr.
know.
Dragon, so formal.
Yeah.
I'm sure.
Okay, we have two questions while that's happening, one from Archie and then Karen.
Good evening, everyone. And thanks for the great information. Question I have, and I'm not sure if we have a lawyer on the call tonight, but does public safety trump my personal privacy when it comes to proving that I am fully vaccinated?
In what aspect? Sorry, Archie, in what aspect?
Well, if I, my personal health records, whether or not I've been, vaccinated or not, is I consider my personal business. So if my employer is saying to me, you have to prove or show us proof that you've been, double vaccinated, then is that a violation of my privacy? And does public safety trump my personal safety or my personal privacy?
So there's also a part that I left out of my presentation here to where one part that I did talk about, there has to be reasonableness, right? But also it seems that there is a case law out there as well, that there has to be an alternative. So for instance, I'll use one of our workplaces, which is Canadian Blood Services. That's the employer that came forward and said that they want to do a vaccine mandate with the employees. So Canadian Blood Services also had an opportunity, and they did put it out there that they did put it out there that they, in lieu of being vaccinated, that they may have to wear a mask at work. They may have to get testing daily or weekly. That's something that they haven't worked out yet, but they did put the alternatives out there. So I believe at this moment, I don't believe, and I think it did happen in BC, but in other places, we haven't seen it come across without the alternative. Even at Dalhousie University, I believe, they're given the vaccine mandate, and other universities, they're given the vaccine mandate, but they're also saying, well, if you're not vaccinated, then you have to be subject to testing and go on from there. So there has to be another alternative as well. I don't think the hard and fast rule of you being vaccinated or double vaxxed is actually contemplated, but how are they finding out if you're double vaccinated or not double vaccinated? So the other question becomes, do you need proof of not being or being vaccinated by your doctor? And that's something that we haven't actually addressed yet in the working aspect of things.
So I'm not a lawyer, but I will offer you a response that comes from the perspective of ethics. And we have this phrase that we kind of use for teaching purposes where we say, your right to swing your fist ends at the tip of my nose. And so the idea there is that you're trying to be respectful of people's right to manage their life, live their life according to their views and their values. But when that starts hurting other people, then the claim is that the community can in fact restrain you. So you can't swing your fist and hit my nose, but you can swing it so long as you're not hurting me or anybody else. And so I think that's kind of why in my earlier remarks, I said it's really important to have provisions in place that offer alternatives to people so that people will trust. And so one of the questions that's come up many times is how will people know? And you've heard Jason say, well, he's willing to share. You've heard me already share. I think that there are ways in which you can create environments where people will share if you've made opportunities for them to still participate in life, but just in a different way. So I'll participate because maybe I'll have proof of vaccination. You'll be able to participate because although you're not vaccinated, you're willing to submit to rapid testing or whatever the measures are. But I think what's really important, and I think this is part of the statement at Dalhousie, because I was working with some of the people at the Health Law Institute there, that what you want to do is minimize infectivity and maximize trust. Now imagine if we had that as our big picture commitment. We want to minimize infectivity for the benefit of everybody, and we want to maximize trust. And if all of our policies could do those two things all the time, I think we'd all just be better off. But as I said, it's not a legal answer, but the ethical answer is yes, you have some freedoms, but you can't exercise them to the detriment of the community and others.
And
Thanks
you know,
for the question.
the whole issue around trust, especially in the African Nova Scotian and the Black community, is one that I think is going to be very hard to come with. And you know, I think the vaccine, or whether or not they're calling it a passport or whatever, is going to be detrimental, I believe personally, to the African Nova Scotian community. Is going to further disenfranchise and marginalize us as a community. And that's why I'm glad we're having this this call tonight. And just one other thing to keep in the back of your mind is, oh my gosh, I just lost my train of thought. Oh, who's going to police it? I can say, yeah, I'm double vaccinated, but who's going to police that? And I work at an educational institution, and when students come to see me, am I going to have to ask them to show me proof?
Yeah, if I can just add something quickly to your comment, Archie, I think it's really important. And in some of the written work I've done around this, I've used Nova Scotia as an example. I've talked about the problem of carding, and I've been able to say these are facts and they are recent and they are real. And how do you know this isn't just one more tool that might be used in that way? So I think the point's really important. I can also say that I've written for recently the Boston Globe. So I'm also talking to other communities. And one of the things that's really important there is that we have data. Again, we got good, robust data that says when people were in the early days, when we didn't have a vaccine and there were rules about social distancing and there were tickets given out for violations, disproportionately given out to members of the Black community, right? So you have data that shows that a lot of these kinds of tools that are supposed to be objective are used in ways that are not. And so your question is absolutely key. Who will be doing the policing? And if I can go back to my earliest comment, where I said there's a big difference between what's happening when you're using it for international border crossing versus activities of daily living, you would hope that people who are working for border services are properly trained and that they would not be discriminatory. But if they are, there are mechanisms for you to actually respond, name, and challenge. That may not be true if it's somebody who's standing at the door of a restaurant. And so I think that's why I'm really worried about when things happen in different arenas.
So maybe we should interrupt the flow right now. Dr. Nnorom is here. Thank you, Onye, for being here.
There was one
question.
Was there another one?
Karen had her hand up for a while.
Yeah. Can we just have that? And then,
sure.
Okay.
Okay, thank you. If you can hear me, I just want to piggyback a little bit on what Archie was saying, but the question I have is that what students have been afraid of as well as parents, and I'm not sure if there's a way to do it, is that some people said they would be okay in terms of the vaccine, proof of vaccination, if their birth date wasn't on there, because they're afraid of losing the card, and then people fraudulent and scammers are out there trying to get their information. So they say, what if they're able to show proof of vaccination, it says dose 1, dose 2, why does it have to have their birth date on there when they do have the MSI has their birthday on there? But if there's a way to show it without having that information, I may have more people buy into it. So I'm not sure if that's something, if that's a possibility. Based on the people who are on the call, I'll listen to Dr. Baylis and Jason as well. But that's what the hesitance right now is among the students and the parents. And then the other question that they're raising is will this be used if you don't have proof of vaccination to come to school?
Karen, can I, it's good to see you. I haven't seen you in years.
Hi, Jason. Marsha's here as well.
Hello.
Hi.
Can I say to you this, and it's, I'm not trying to be smart by it, right? But just to open the conversation on it. Way back in the day when you were going to JJ Rossi's, how eager were you to show your ID that had your birth date and all your other information on it?
I did. I showed my driver's license. Whatever it was, your ID, your driver's license, whatever.
Right. So
I'm just putting the information out there. I'm letting you know what community members are saying. And I'm just asking the question, is there a possibility? That's all I'm saying.
Well,
I think that was for a different purpose, though. That was for a different purpose, showing your ID at a nightclub than to show that you have showing your ID with your birth date on it, that you're vaccinated, that, you know, different purposes.
Yes. Well, I would argue that they're different purposes because.
Did you see me at JJ Rossi's or something? Jason.
I said JJ.
Why you bring that up? You should have brought up the Derby. The Derby.
Okay. All right.
So I think we do.
No. But just one moment, if I could.
Okay.
When you're looking at the vaccine passport, and again, I'm not a proponent for the vaccine passport or anything like that. What has to happen is the fear of what's going to happen to my information, and there needs to be, I believe, an opt-out for people. But what we need to do is not, I guess, and I'm sorry for using this language as well. I find a lot of people are confusing their rights with their privileges when it comes to what the use of it is going to be, and none of that has been spelled out for us. Only, I guess, anecdotally, when they're talking about, oh, in order to go to this restaurant, you're going to have this or whatever. But that hasn't been sanctioned by government yet, and I'm really hesitant to go where it is until I get some answers. So sorry for not answering you, Karen, but I was just trying to bring the vaccine passport in and normalize it a little bit. By saying we do have our driver's license on us, or our way back our liquor store ID that had all of our information on it at one point. So as things change, other things may become normalized. And I'll tell you, privacy is a big issue. We've seen that ever since the Patriot Act and the growing of the internet. And we do give up a lot of our liberties from time to time when it comes to signing up to Google for this or signing up online for something like that. And we're consenting to give our information away. But I do understand the question. I just think we all need to look at it in a way that where else do we give our information? And is that giving our information more important than the public health safety aspect?
Okay, I'm sorry.
The one thing is I just want to say that I think it's a sense of trust. That's all I want to say.
Yeah, okay, thank you. So we'll interrupt the flow. I'm sorry to interrupt the flow, but Dr. Nnorom is here. She's our third panelist, and thank you for coming. And basically, we're asking all the panelists the same question, which is, what do we as a people need to know about the proof of vaccination and vaccination passport? So we just need to hear your perspective. Please introduce yourself before you address the question, and then we'll open it up after that and have our good discussion. Thank you.
Hey, thank you for having me. Sorry, I was late. I was at our Black Health Vaccine Clinic, clinic meeting. So I apologize, but this is wonderful. So I'm grateful to be here. I'm located in Toronto right now, the land of Haudenosaunee, and many other groups who have kept this land for so long. So in thinking about the vaccine passport, so I am a public health physician. I'm the president of the Black Physicians Association of Ontario, but I also have formal training as a family doctor and public health specialist. Speaking of those titles in particular, I've had a number of different conversation. So I'll kind of lay that out as far as the benefits and the risks using a Black lens. So the benefits, of course, I think you folks have covered it from a public health standpoint, is of course, as we learned in public health, when you can legislate something, when you do something at a policy level, you see a greater shift than when you leave it up to the individual. So here in Ontario, we've already gotten the marching orders. They'll be implemented, I think, as soon as next week, that, indoor dining at restaurants, being able to go to the gym, bars, and certain other recreational areas, people will be required to show their proof of vaccination and their own ID. So whether that's a driver's license, passport, that kind of thing, but do that every time. So to be walking around with those documents. So there has been an increase in the uptake of people signing up for vaccine clinics, which is what they were hoping for. And I think within our Black physician group, I think quite a few people do support these mandates and the vaccine passports, but we do have a number of concerns, and I think some of them were mentioned here. And it was just mentioned, the issue of trust. So where we sign up for something, that is where it's a decision that we make on our own. It's different when something is being mandated by the state. So one of the thoughts from some of our senior physicians is that it will improve uptake in the short term, but is likely to backfire in the long term. So numbers will go up, but where you're asking people to inject something into their bodies against their will, essentially, that does not help trust at all. And it happens in the context where this is not the first issue that the Black communities face that put us at risk, but there has not been sufficient in any region, even though I'm in Ontario, I could say in Nova Scotia, there hasn't been sufficient government action to demonstrate that they really care about Black lives historically and prior to this pandemic. So it certainly does not help in that regard. And I think, for us, we do feel like we have a role to play in at least explaining the disparities and the need for the vaccine and the benefits, but it's certainly going to be a problem. But I think the other thing is the fact that one needs to do, and I'm using a fancy term, but really it's called a racial equity impact analysis. It's looking at the policy, and you might not decide, okay, the policy has to be banished or whatever, but where you have a policy like this, it will disproportionately impact us. And I had, a conversation with Dr. Onye Dryden, who is on the line, who's one of my colleagues that I work with very closely. And just to summarize it briefly, we're kind of sometimes looking at it from the lens of, the people who are not vaccinated might experience issues. But we have to remember that we're in North America, and being Black makes us guilty in the first place. So we are going to see people who are disproportionately impacted, whether or not they're vaccinated. So somebody wants to, at least in Ontario, somebody wants to walk into a restaurant, they have proof of vaccination, but they forgot their license at home. They're spoken to very rudely to get the hell out of the restaurant. But Chip comes in, who's, white Canadian and well-dressed with his family, and says, here's my proof of vaccination, but whatever the story is, and he gets to sit at the restaurant. These are things that are not made up. We know that this is part of our lives. So working with policymakers as much as we can, or working in community to try to advocate around that, because the way that we are treated by authority when there is an opportunity for surveillance, as was mentioned earlier with regards to lockdown and things like that, it ends up disproportionately impacting us, whether we are within or outside of whatever the mandate was. So I think that's something to keep in mind as we move forward. There are benefits to the vaccine passport approach, but for us as Black peoples, there are significant health impacts when it comes to how these will be enforced. So personally, my position would be actually to delay them or find other means, but if they have to be implemented, then some harm reduction strategies need to be in place for our communities. Dr. Haase, to answer your question.
Okay, thank you very much. So we can go back to our questions, either in the chat or put up
David,
a
can I
hand.
just-
I see that Letty has her hand up.
Before Letty asks her question, can I just maybe jump into Karen's question from before?
Yes.
With respect to the comment about the birth date on the vaccine certificate. I think for me, and it may not happen here in Nova Scotia, but it is happening elsewhere, and it could end up happening with respect to travel. there's a lot of hype and interest in technology. And so it may not be your birth date that's there. It may be a QR code, and it may be a QR code with facial recognition. Because the whole challenge, no matter what you use, whether it's electronic or whether it's paper, is they have to be able, in theory, to connect up the data about vaccination with the person in front of them. Right? So how do I know this person who's presenting this data that says they've been double vaccinated is in fact that person? And so one of the things that has been proposed in some places they're working on, as I said, is a facial recognition app. Well, that in and of itself is going to be disproportionately impacting the Black community. We just know that. Again, there are facts there that I think are relevant. And so I think that one of the things we really need to be thinking about in this arena is the whole technology creep. So I just don't want that to get lost also, that it isn't just your birth date. It's how people are going to choose to connect up, who's in front of them with the data. And I think that there's another whole set of concerns that ought to be front and center there. So I just wanted to add that to Jason's answer from before. Thank you.
Right. So back over to you, Letty.
So my question is, or I guess my point is, I'm terrified that if for any reason I end up contracting COVID because someone didn't carry or is not double vaccinated, or however I get it. So I guess on a personal note, I'm for having some kind of passport because of being afraid of getting COVID. I think we're, like everyone says, we're impacted with being marginalized anyway. And I think what we need to do is remember those who have had it and have gone on, unfortunately, because they've passed, and those who might have it or are high risk, like I am. I mean, I'm super high risk, so it scares me every day. And we even think about, like, what about our families? I mean, if just because that's our family member, they don't need to be double vaccinated or don't need to carry, and if they're showing up at your home. So those things, and I think we forget about that. And just going to the supermarket. I mean, I'm disabled and I don't work, so I'm home. A lot of the people that are on the panel today are all professionals and are in a job in some capacity or not. But what about us who aren't and are home and our home because we're high risk? So what do we do? And what can you think about to keep people like myself safe? And let's worry about Black Lives Matter, because we do it every day. We have groups, we have organizations. So that's already our fight, and it has been historically. So let's just figure out some way of keeping us safe. The ones who, because historically and hereditarily, as African Nova Scotians or as African Canadians, we are marginalized, but also we have, we're at high risk for certain diseases and disorders anyway. Let's take care of that as well.
Right. Thank you, Letty. Yeah,
thank you.
Good point.
Someone might like to respond, because that's, we certainly understand where Letty is coming from, and living with that fear is very difficult, always. So invite any of our panelists to respond to her.
I just want to say that I share your fear. I have family members who are at risk. We know the Black community has a lot of health issues that puts us at risk, and it's been proven that COVID-19 has disproportionately been hurting the Black community more so than other communities. So I just want to say I agree with what you say there, and I do believe we need to protect ourselves, but it still brings us back to the question of trust. And I think governments need to go above and beyond, and they haven't done that thus far. So we're looking at some decisions coming out from this government, but I don't see a huge uptake from the leaders that are there to address the issues that the Black community is dealing with. And we can't be an afterthought. We need to be upfront. And I do have a little bit of a beef with government as it pertains to that, because I had a lot of members that were reporting to me what was going on in the clinic in North Preston when the testing clinic first opened. And I heard earlier on that it took a lot to get the clinics open. And I tried to chime in there, and the issue that I ran up against was, oh my goodness, what you did was you made the community afraid to go there. And I was like, I definitely don't think that happened. What I did was reach out to you over and over again, and it took, I guess, going to the media and bringing those issues forward for you to actually really act on things. So I believe government needs to go further to gain the trust of the community, but I don't see it right now. And I know there's a lot of people talking, a lot of people reaching out, and we actually need to get them there. So I do hope whatever they come with is something that keeps the Black community in mind.
Right.
If I could respond to what Jason said about the clinic in North Preston, I think, Jason, what the issue was, you went to the media before visiting the site, and after you visited the site, you declared, and you went publicly stating this, that the clinic was up to par. So instead of going to the media first, you should have went to the community to visit the clinic first. That's all I'm going to say on that.
Yeah, that is not correct, Archie. What happened was I did go to the 3 clinics, but the one clinic that I did speak of was different than every other clinic in this province, and it wasn't up to par. And then the action got done. But I reached out to Dr. Strang and the Premier several times before they acted on it, before I went to the public on it.
But after you visited the clinic, you did go publicly to say that no, the clinic was up to par after you had visited the clinic.
It was a different
and
clinic.
I'm not going to belabor this point, because I don't.
So I'm going to use the host privilege
a point that we need to
because
belabor
this
right
is
now.
you're sidetracking us. So we need to go on. Mayan had your hand up, and then Louise, please.
Good evening, and thank you everybody for the great presentations. I guess the concerns that I have is the regular concern about how we're racial profiled, we're followed in stores, etc. And I almost see this as an opportunity for people who have their covert racism to keep us out of stores, out of movie theaters, out of restaurants. So the question I have about showing passport, what does the passport look like? I mean, are they going to be different? Like right now, I have my shots on my iPhone. Is that what I show? I also have papers. I can use what I photocopied off. But what is it what it's going to look like? Because people could say, well, that doesn't look real to me, so I'm not letting you in, or something like that. So I'm just curious about, should we not have something that's valid looking?
Dr. David, they haven't figured that out yet, have they?
Yeah, well, here in Nova Scotia, we really do not know. Other places, you've heard about the QR code. Some places have an official kind of laminated card or whatever, but I don't know. Onye, what do you have in Toronto?
So it's just been announced and it'll be implemented over the next couple of weeks. But what they've decided is it is paper or electronic proof of vaccination with your ID. So it's either like your license, your passport, that kind of thing. But again, it's traveling with these things always, right? So each store every day. And yeah, they could say this exactly. They could say this looks counterfeit if they don't want us in there. I think I also want to just, I believe her name was Letta. I just want to say, I just want to say, like, I I don't know what it is to walk in your shoes, but I'm so, I felt it, you know, as far as the fear. And I think that's part of, like we do the work, like BPAO, we're vaccinating. So we definitely want to see our community members vaccinated. And for us, it's coming from a spirit of love. And I'm just not sure that the vaccine passport piece, without thinking about how to mitigate, how to address these issues that we're talking about, I think that's the piece. It's not necessarily that you can't have a vaccine passport, but they haven't even thought about how it will impact us. And also, anyways, I've heard some things that they might have thought about it, but it wasn't a terrible concern of theirs. So moved forward anyways, but I don't know, that's hearsay. But nonetheless, I think no one's gonna, honestly, my honest opinion, as a physician, but also as a Black woman, is they're not going to save us. We need to figure out how to save ourselves, map out all of the different ways this can impact us, and perhaps advocate for ways to address it and to make sure it doesn't happen, because they're not going to sit at these tables and actually come up with a solution that serves us.
Exactly. And that's what happens all the time. Who's sitting at our table right now? And if we fight for not having the passport, that just lends more to those in our community who don't have the trust, and then also don't completely understand the importance of just being safe and getting vaccinated to stay safe, healthy-wise, so that then we're not losing ourselves in numbers because of COVID and catching it. So that's the other thing. These people who are dying because of COVID in our community are dying because, are dying mostly catching COVID because they didn't understand it. They didn't understand it. They're still not getting it. So they're saying, they don't believe it. And then they're still having, going and being unsafe. And it's so simple, but it's so complicated. But we look at it afterwards. We're always being reactionary instead of being pro-action. We are such a smart people, but yet we are so stupid. And we don't have to. I'm sorry. I'm very passionate about this. And as a lot of you guys know, my husband's in one room and I'm in the other. And I think we totally are polar opposite when it comes to this issue. But I am terrified. I really am. I mean, I've been for 3 days and I've been double vaccinated, but I've been having breathing oxygen issues. Just the slight bit of swelling in my feet, then my oxygen level goes down. So I know how it's going to feel if I get it. And people like me could be out there on the forefront talking to people in our communities and saying, look, the importance. I felt it to be, and I know this is, I don't want to monopolize, but this is a community hall. This is a town hall. I think it's important to let you guys know. I was really blessed and honored that I had the opportunity to take part in being helping out with getting our communities vaccinated in one of our communities. And there were people who know me because we're part of the same community who were calling me, and they were worried about getting tested. And I felt very confident and comfortable because even though we were virtual and I didn't go over to their house and bring them to the clinic to get their vaccine, but they were so comfortable that they went because they trusted me. Because that's who are we going to depend on but ourselves. So let's use the tools and the techniques that we have, and then also follow status quo from the westernized world, because that's how smart we are, and not always gathering together with associations and ad hoc groups, and let's just get it done, because no one else is going to do it for us. This is going to be here for a long time. So let's work on some proaction and also some reaction. But come on, people.
Yeah, we certainly hear you, Letty, and you make good sense. And that is one of the reasons why we reach out to you, and you are part of our HAAC network, right?
Right.
Because that is the work that we try to do in these town halls, is to give us the opportunity to understand the issues, to support each other, but also to hear you, right? So we do. I'm gonna move over to Louise, because I know she's been waiting a minute or two. Sister Louise, where are you? Come on, let me see you. What's your question?
Not surprising to many of you, I have a question in 3 parts. So there's getting the vaccine and the benefits to yourself and the benefits to keeping your community safe. But I jumped on the call a little late. So did any of the panelists talked about the importance of the other protections and restrictions? Because as I understand it, and from what I've read and from what I understand, even double vaccinated people can still get sick and can still infect other people. So that's, I guess, 2 of the 3 parts. The third one is, I'm looking to you, Jason, and it's and maybe Francoise around the ethical piece, and then the supports for those in our community who choose to quit jobs where there is mandatory vaccination, or who in other ways will be impacted because of decisions they make that then now remove them from contributing to the economy and their families. Because I think it's been said already, you might see vaccination rates responding to the restrictions, but those who are convinced that they're not going to get vaccinated are still not going to. And that now means barriers. And it's kind of, I'll be honest with you, ironic to me that we are introducing the same policing tactics in a context where we're talking about decolonization, but this is 2021 and the world we're in. So those are the 3 parts of my question, is around the vaccination, the continuing of masking and other safety practices, because being double vaxxed doesn't mean you won't get infected. And then this other piece of the ramifications of not wanting to stay in employment because of mandatory vaccines. Thanks.
Well, it sounds to me like we have answers to come from all of our panelists. Choose your part of Louise's question and jump on in.
Well, the one thing that I would say is that I did try to suggest that we should be worried about being overly confident in vaccines, not because vaccines are not great, they are great. But one of the things I said, and I think it bears repeating, is that no vaccine is 100% effective. Even the best of the vaccines are not 100% effective. And we know that they are of reduced efficacy with respect to the Delta variant and possibly Mu and some of the other variants that will be coming. That's one of the reasons that I keep arguing for thinking about this as just one tool in the toolbox. And I think one of the other tools that's super important is, in fact, rapid testing. And yes, rapid testing too is not 100% accurate. You can have false positives, et cetera. But in theory, if you were to think about that for both the vaccinated and the unvaccinated, you would be doing more in terms of protecting the community at large, because people who are vaccinated could become infected and could infect others. So that's one part of the question. I think the other thing I want to say is that a lot of governments who are bringing this in are saying it will help increase the vaccination rate. And that's true, and we have seen that. But if you look at the measures, it's increasing the vaccination rate again, for a very particular kind of population. Part of that population is youth, 18 to 24, 30, whatever, who do want to go into restaurants and bars, who all of a sudden are saying, wake up call, oh, well, I better get myself vaccinated. But that doesn't help people who have genuine fears because they have an underlying health concern. It doesn't help people who have had one vaccine, had a terrible reaction, and are fearful of getting the second vaccine, so they will not be fully vaccinated. That doesn't help the single mother who has 3 kids at home because they're out of school and works the night shift and can't figure out how to get themselves to a vaccine center because life is complicated. And so I think that's exactly one of the things I worry about, is that there's putting a lot of onus on one place and one kind of solution, when in fact the problem is multifaceted and requires a really complex, multifaceted response that is going to respond to the different challenges that different people are experiencing. And and the case study I've just given you about the single mother is very different from the 18 to 20-year-old who wants to go out to the bar and they're just going back to the university, who now also is going to be mandating that the students be vaccinated. So I think that there are a lot of issues, and I think it's really, really important to not see this as the silver bullet. And I do worry that some of the ways in which the policies have been written and are being enacted will encourage that, which will also then eventually, and I think, Onye made this point about the short term and the long term. We're in this for the long haul. And so we can't be running after short-term gains. We really have to be thinking about the long term. And if we keep undermining trust, we will all suffer ultimately. And I think that's a real problem. And if I can, I know this is local, and local meaning Nova Scotia and Canada, but we really aren't even doing really good for the world, right? We really should have to worry about the fact that we are very insular in our perspective. We have not reached out to the world, and we continue to tolerate huge injustices and inequalities. And if you think about that, many of those places are in Africa. It's unacceptable, the low rate of vaccination that we have globally.
Well said. Over to you, Jason. Did you want to have a response to Louise?
Yes, I'll talk about the employment implications of people leaving their jobs. We're already seeing that, and I'm talking about mainly in healthcare, in acute care, long-term care, and home care, where we're seeing people leaving their jobs. But absolutely on the vaccine mandate, as earlier when I was speaking, Louise, I really took some points out of a legal opinion that we received, and all facts aren't equal based on, all facts are different. Nothing is equal. It's somebody's own circumstance. And what we're trying to do is reach out to the membership to really let them know that you do have rights, but also public health guidance is just that. I find it very difficult for me to speculate on what a vaccine passport is going to be in Nova Scotia without it actually being applied. And I certainly hope that there will be more consultation. And as a matter of fact, I wrote a letter to the Premier the other day about that. But what my plan would be to do is to take each case by case by case and try and fight it. But I'm still working on all different levels within my own union to create trust, right? So there will be people that will reach out to the union, talk to the union, and we'll be able to deal with those issues. But then my fear is the people that do not talk to the union and just up and quit. So there's nothing blanket that can be done until we know what it is that's coming out. But definitely we will be taking it case by case. And if it's something that is really egregious that comes from them, we will fight that entirely, if it is indeed a fight.
Okay. Over to you, Dr. Nnorom.
Yeah, so I think with the piece around disproportionate impacts, so we're still grappling with that within the Black Physicians Association. We've tried to map out what we can do, and we're exploring other things. So looking at recovery generally, because the Black communities here, and I presume across the country, have been disproportionately impacted job-wise before this mandate. So thinking about how we can help people and access social resources. So when we go out to vaccinate, we're doing like micro-targeting now. We want to let people know where they can get food, where they can get social services, where they can get programs for their children, just basically holistic view, whether they get vaccinated or not. So again, providing the sense that it's about love and we care about their health beyond the vaccine, because we've seen people come to our sessions and actually not get vaccinated but come back later and get vaccinated. So thinking about these pieces, thinking about where we haven't decided on it yet, but making it possible for people to know where they can go for legal advice. If they are, questioned, harassed, or et cetera, by the police. So considering that as part of our role with regards to health and overall harm reduction. We have a physiotherapy group who's also looking at, if you do get COVID-19, there are actually ways in managing that to reduce the level of harm if you do contract. So we're trying to kind of almost, yes, continue our vaccine outreach, but look at almost like a harm reduction approach holistically from the health standpoint. But we haven't quite landed on a particular strategy, but those are the things that we are thinking about, and some of which we've already implemented, but it's quite it's a little bit daunting. But I think that's the responsibility, as Francoise says, it's a multifaceted approach that's going to be required. But I think like Black Health, Black Love, harm reduction lens might be what's needed, because these passports are coming.
Dr. David, I think Dr. Onye had her hand up.
Hello. Good evening, everyone. Thank you so much. I just want to thank HAAC, actually. From the time town halls began, they've been pretty much fantastic and phenomenal. And every time I get the live link, I retweet it and I reshare it, because I just think there's information there that's just not happening in other places. And so I'm going to make a couple of points, then I'll stop talking. I too am concerned about facial recognition. I think there's been quite a bit of research done on the ways in which AI cannot read Black faces and how algorithms are inherently racist. And so what does it mean to add facial recognition to whatever passport, immunization record, whatever we want to call that? I'm also concerned because I don't want us to rely on bringing the government, NDP, Liberal, PC, on side into knowing, like waiting for that process to happen for us to be able to say, okay, now we'll be taken care of. Like I appreciate the statements that we know we need to care for ourselves. You know, I have a Canada citizenship card, which is officially, you know, given to me. And I've been, back in the day, I've been in way too many clubs where they're like, oh, I don't think that's real, or that doesn't look right, or why would it make it in that way? So there's always an excuse as to why your official documentation can be suspect. And so I think we had, you know, I appreciate that conversation about how do we respond to that. And so the question I was going to ask, and that Onye suggested, was what do we do for ourselves during this process? So I do some kind of research on public health protocols. I'm thinking about the way that typhoid Mary Mallon was treated, and then the ways in which we see those same things happening now. I've written about how Black people in the Atlantic have been unfairly targeted through ticketing, imprisonment, losing jobs, being run out of cities, right? Like these kinds of things during the pandemic. And so what do we do if we think about it in a mutual aid, or how we, as a community that cares for each other, how do we intervene with ourselves, or how do we support ourselves through this system that will come into place that will ultimately disproportionately negatively affect us? So what do we do? How do we set up a buddy system? How do we document where we were, you know, treated poorly? What do we do to intervene simultaneously while there's many of us still working with the government, but what do we do at the community level to make sure that we're protected and cared for during this passport project? So that's my question.
It's a good question. It's a question to all of us, apart from the panelists. It's for all of us, isn't it? But and certainly anyone want to jump in. And Dr. David, you too. What can we do, folks? Let's talk about it. All right.
I think having conversations like we are now is even opening people's minds to it. We have to continue these discussions, whether it's at our own kitchen table talks, whether it's in larger forums, town halls, but we need to keep discussing it and talking about all aspects of it. Like I've heard some things here tonight from folks like that, oh, that's a good point. You know, I hadn't considered that. I remember the first time when I met Francoise at another presentation we were doing, when she even raised it, was like, oh my gosh, we hadn't even considered that. We were so busy trying to get everybody vaccinated that we weren't thinking of the implications of what possibly could be a passport. So I don't have the answer, Dr. Dryden, but I keep thinking, let's keep conversations going with one another, our families even, because I know there's people in my family just saying, no, I'm not getting it done. I was like, well, why not? You know? So.
Yeah, and I see that that Dr. Onye will want to speak as well. But I do think that what I heard that was very helpful was to understand the implications. And I really appreciate that Dr. Baylis was saying, think about what happens if this happens. We need to challenge, and not only challenge, but we need to assert ourselves in terms of government's responsibility to us. It seems HAAC forever has to teach government about culturally specific approaches, that one size doesn't fit all. How many times? How many times? But clearly, without us saying these things and being and holding them accountable, they're not going to. So this ability to evaluate, to assess what's going on and to share information is vital. And we have 3 people ready to speak now. So so all of our presenters, starting with Dr. Nnorom.
Yes, so I hesitated in answering the question because I'm not in Nova Scotia. I'm not in the context in which Dr. Dryden is and all of you are. But I think it's really, Sharon, what you mentioned, like thinking about what the implications are and then planning around that. And yes, there is a role for government, but sometimes when we wait for that, it doesn't come, or it comes so late, it's just ridiculous. So I think the pieces that Dr. Dryden mentioned around, like, yeah, is there a website where people can talk about what has happened to them with police or wrongfully accused, or a way of collecting that data? Are there other ways through community organizing and strategizing, which actually we kind of inherently must know, because that's what our forefathers and foremothers and ancestors have done this whole time, to organize ourselves to make sure that, again, it's about mitigation at this point of the harms, even if they're unintended or sometimes intended. So I think even, I don't know if it's another town hall or how you folks do things out there, but really asking the questions, what are, based on the analysis, what do we do about A, B, C, D? That's the questions that we're asking ourselves here. And one tricky question is, whose space does this let, what's the role for CABLE or the Canadian Associated Black Lawyers? What's the role for BPAO? What's the role for those in government? So that we're in alignment, but also not duplicating efforts, because we're all tired. So thinking about that.
Yeah, for sure. Dr. Baylis.
So I'm going to offer a comment, and I hesitated to answer because it's a big question. You know that, right? It's a big question. But I'm putting this out there just to float an idea, right? I said earlier on that I think what we really need is some kind of responsive program that has as its priority to reduce infectivity and maximize trust. I actually think that most of the people that have some measure of authority in this space, and let's just take public health as one place where there's some measure of authority, I think that they think, despite all the uncertainties that are still true about COVID-19, I think that they think they know how to reduce infectivity. And they're introducing various kinds of policies to try to achieve that goal. I'm not always persuaded that they're transparent about the fact that they have other goals. It's not just actually about reducing infectivity, because if they did, and you looked at just what is proposed for Nova Scotia, it doesn't make sense. So for example, in Nova Scotia, when this comes into play on October the 4th, in theory, I can't go into a restaurant unless I'm double vaccinated. And that could be a small restaurant that can only accommodate 20 patrons, but I can go to a faith service where there might be 250 people, right? And so there's some real unusual features of the divide as to where you're going to need to show this and where you don't need to show this. Another place you're not going to need to show this is in government, accessing government services. And that's really interesting. Is it because Trudeau will make sure that all the government service people, at least in the federal offices, are going to be vaccinated, so you don't have to worry about going in there? But is that going to be true of provincial services? I mean, and again, so there's some weird stuff, okay, but leaving aside the weird stuff, let's assume that public health is kind of knowledgeable about how to achieve the first goal of reducing infectivity. I am not at all persuaded that they have any of the knowledge required for how to build trust. So if that equation makes any sense, I actually think we're at a point where sometimes, you think the person that loves you should just know you well enough to, get you the right present and say the right thing when you're down, et cetera, et cetera. And sometimes they don't, right? And they love you, right? And so you have to tell them, you know what, this is what I would really like for my birthday, or you know what, this is what I would really like for dinner. And so sometimes even the people that love you, you have to tell them what you need. And so I think, there is a really important role for being proactive under the banner of these are the things you need to do to build trust, and you ought to know that you need trust. Now, unfortunately, I'm saying that in a very specific context. I think all of Canadians in different arenas for different reasons don't trust government for all kinds of things. But I don't think that's the problem for today. Today's issue is really specific. And so I think, the resources of the community could be brought together to try to find ways to say, look, you want to reduce infectivity, and you ought to want to want to maximize trust. And, we're not going to fight with you about how we're going to go about the first. We're going to try and tell you there's no way you can know the answer to the second. And so we're going to help you and try to present yourself as a partner. We're going to help you because you want that too. So that's my idea. I'm throwing it out there, and I hope it's not too naive.
No, I don't think so at all. And I'm going to say last word to Mr. Maclean, because it is time. See how much fun we have when we get talking. Mr. Maclean, take us out, and I want to then thank everybody.
Well, thank you for letting me have a word here, and really thank you for calling me Mr. But I'll be quick. I don't want to oversimplify it, but I'll use a word called collusion. Right? There are many organizations that our community is active within, but I think what we need to do is start leveraging more, what HAAC is doing, what the social work group is doing, what other groups are doing, and your issue is my issue, and we all need a hit from our own angles to whatever lobby it is, into bringing it to the attention of others. And I just think we need to really grab onto our diversity, and to be our diversity in groups, and be able to put the same. And I know that Dr. Nnorom said, without duplicating or efforts, but I think repetition could be key when it's coming up, not having one group hitting it one way and another one hitting it another, but to overlap on that just a little bit, to where the same message starts to get hammered through to those that don't understand what our true issues are.
Well, thank you. With that said, I think it would be, I'm just going to ask this marvelous panel to please write, please send us information, please direct us wherever it is that you think that we can get some of these answers, because it seems to me that we did a great job selecting the panel tonight, and so this has been so helpful and so gratifying, and to have our people involved in the conversation, so it's just been really great. Yes.
Just before you end, just in the chat, Melanie Starr, who had to leave, she just made a comment that she is writing an article at the Dalhousie Medical School with Francoise, and she's asking people if you have opinions or perspectives regarding this issue to contact her.
Oh, that's terrific. So there's a place there. And I think that my colleagues at HAAC would tell you that if you write us, we will do everything we can to answer you. And this likely won't be the end of the town halls. And going forward, we'll deal with things as they come. But I want to sincerely thank our amazing panelists. You really have to know how much we appreciate what you were able to offer us this evening. And I want to also thank all of our participants. It's Friday night. You can never know what's going to happen on a Friday night. We have a small crowd, but it's been mighty. And I do also want to tell you that because this has been captured on by YouTube, thanks to our amazing Carla, we are able to have this on our HAAC website. So no doubt you'll have friends and co-workers who will say, well, what was that about? And was that worth your time? Yes, 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 it was. And you can find it on our YouTube channel on our HAAC website. Correct, Carla?
Not the HAAC website, but on the HAAC YouTube page.
The HAAC YouTube page. So there you
Sharon,
go.
if I could,
yes.
I just want to let the group know that Jason and I have been talking offline, and we've come to a mutual agreement on the discussion that we had. So because this is being recorded, and that discussion was recorded, nobody's going to see the offline chat between Jason and I. So I just want to let people know, and people that might watch this, that my brother Jason and I have had a good chat on the chat.
Oh,
Well,
you can go to bed not mad.
Yes.
this is terrific. And that's an example of the love we have and how we work stuff out and help each other.
Yes.
So
yes, indeed.
So,
Thank
you know,
you,
it's all good.
that.
Thank you so much. And Dr. David, any last words except goodbye?
Thank
No,
you. It was
just echo
wonderful.
thank you. This has been wonderful.
Thank you, Jason.
Great.
Take care, everyone. Thank you.
And,
Good night, everyone. Thank you.
Good night, everyone.
Okay.
Night.
Take care.
Night.
Good night.
Night. Nice to see you, Onye, and hear you as well. Night.
Thank you. Good night.